to prevent and reverse lifestyle-related diseases through the promotion of whole food plant-based nutrition. Tonight, you're going to hear from one of the forefathers of the plant-based movement, Dr. Caldwell B. Esselstyn Jr. He received his BA from Yale University and his MD from Western Reserve University. In 1956, pulling the number 6 oar as a member of the victorious United States rowing team, he was awarded a gold medal at the Olympic Games.
Oh, really?
Dr. Esselstyn was trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. In 1968, as an Army surgeon in Vietnam, he was awarded the Bronze Star. Dr. Esselstyn's been associated with the Cleveland Clinic
Mary, you muted Brian.
I got muted somehow.
Okay, there
Yeah,
you're
I
back.
think I was trying to mute everybody else with the background noise. Sorry about that.
That's all right. During this time, he served as president of the staff and a member of the board of governors. He chaired the clinic's breast cancer task force and headed its section of thyroid and parathyroid surgery. He is a fellow of the American College of Cardiology. In 1991, Dr. Esselstyn served as president of the American Association of Endocrine Surgeons. His scientific publications number over 150. And in 1995, he published his benchmark long-term nutritional research in which he demonstrated the ability to not only arrest, but to reverse coronary artery disease in severely ill patients using a plant-based diet. So without further ado, here is Dr. Caldwell B. Esselstyn Jr.
Thank you, Mary. It's a delight to be with your group. I think this is going to be so exciting.
Thank you. Me too.
I'd like to share with you today my research and my strategies for treating cardiovascular disease. And since we've got a long ways to go, I think we'll get started. Now, just give me a chance to get my slides up here. That way we'll protect ourselves from any omissions. Bingo. There we go. Thank you, Brian. Treating the cause to prevent and reverse heart disease. Okay. Now, let's suppose that you were a cardiac surgeon and you decide that you were going to hang out your shingle to practice surgery in rural China, the Papua Highlands, Central Africa, or the Tarahumara Indians, or in Okinawa. Forget it. You better plan on selling pencils. Why? They don't have cardiovascular disease. As a matter of fact, we have known, and this is a very embarrassing figure for the American Heart Association, I feel, we have known really for 100 years that there are multiple cultures on the planet Earth where cardiovascular disease is non-existent. Now, what you're looking at here is the oldest slide in my presentation. I took this in 1968 when I was leaving Vietnam as a combat surgeon, and it reminds me to share with the audience that when we autopsy our GIs who die in combat in Korea, for example, 80% of those average 20-year-olds already have gross evidence of coronary disease you can see without a microscope. Not enough for their cardiac events yet, but there it is already established at that young age. So that same study was then repeated in 1999, 45 years later, looking at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. Now, the disease is ubiquitous. You go to high school in this country, you get a diploma. You also get the Foundation for Heart Disease. Not a good plan. Now, that's the study, the actual reference to the study I just mentioned. Now, it was in World War II that we really had an opportunity to get it right. You recall that when the Axis powers of Germany overran the Low Countries of Holland and Belgium, and they occupied Denmark and Norway. Characteristically, the Germans took away their livestock for their troops. So the cattle, the sheep, the goats, the pigs, the chickens, the turkeys were gone. And suddenly, these Western European nations during this time period became plant-based. And lo and behold, it was Doctors Strom and Janssen who in 1951, reporting in England's leading medical journal, they looked at the deaths from heart attack and stroke in Norway during this period. So let's focus together on the left-hand side of this graph. And what you'll see is in 1927 in Norway, deaths from heart attack and stroke were going up. 1930, they were going up. 1935, they were going up. 1939, in come the Germans. Suddenly, whoop, the deaths are decreasing. Again, who knew these Germans were these great public health educators? But look what happened in 1945 with the death of Adolf Hitler, the cessation of hostilities in the European theater. Immediately back comes the meat, back comes the dairy, back come the strokes, and back come the heart attacks. But sadly, we didn't get it. Now here, you're obviously seeing what appears to be a normal artery, and is on the left, with a highly diseased artery on the right. And you're probably saying to yourselves, when that small opening blocks off, there's going to be a heart attack in that area. Well, interestingly enough, not so. Only about 10% of heart attacks come from something that looks this nasty. And we'll find out shortly how 90% of heart attacks occur. But the key here is that this blockage on the right has taken years to develop. And what happens is the downstream heart muscle recognizes that it is not receiving its due supply of blood and oxygen and nutrients, and it begins to make its own bypass. So you often will see sometimes when an artery like this is 100% blocked, there will not have been a heart attack because there are these small blood vessels that the body has formed around this blockage. We call those collaterals. And those small collaterals are often giving enough blood so that the downstream heart muscle, not getting its normal supply, still is getting enough to sustain the viability. Now, what I want you to notice on the left, the innermost lining of that artery, there's a little dark line. That's a single layer of cells that are quite magical called the endothelial cells. And when you have been eating a milkshake, or when you have been eating a pizza or a cheeseburger, the cellular elements within your bloodstream begin to get sticky, sticky, sticky. Your endothelial cells get sticky. Your bad LDL cholesterol gets sticky. Your platelets get sticky. And here I want you to see a slide that is of Peter Libby from Harvard. Now, even though I went to Yale, we often will look and borrow some of the wonderful things that Harvard has discovered. To orient you here, in the blue is where the blood is flowing. And then if you look at what is separating the blue from the artery wall, there's that single layer of endothelial cells. They're kind of purple on this slide. Now let's do this together. Let's go to the upper left, and there you will see the small, hard, dense LDL bad cholesterol that has been sticky because of what you've been eating. And it migrates to the endothelial wall, identifies an opening, and passes through into the subendothelial space, whereupon it now becomes oxidized by the food we've been eating, by these free radicals. And now, since the subendothelial space does not like that small, hard, dense, oxidized LDL particle, it calls upon the SWAT team, which here Peter Libby has painted blue. And the SWAT team comes through and begins to sort of gobble up like Pac-Man, going from left to right here, gobble up those small, hard, dense LDL cholesterol particles until we get all the way over to the right-hand side when that cell is now absolutely chock full of those LDL particles. And then we in medicine do what we do so often, we change the name. It is now called a foam cell. And the foam cell is truly the Darth Vader of this sequence of events, because the foam cell manufactures these nasty substances called metalloproteinases like stromatolin, elastase, collagenase, myeloperoxidase. What do they do that's so bad? They progressively will thin out, as we look at the figure on the left here, they will thin out the cap over the plaque, and it gets thinner and thinner and thinner. Now here, what we're looking at, if you can forget the x-ray, but the artist has drawn the artery that is now half filled with blockage or plaque. And if you look at the part that is open, the cells that line the opening are the endothelial cells. Now, we used to think of the endothelial cells up until 1980 as nothing more than these cute little red bricks that are lining these wonderful pipes of ours. However, that all changed in 1980 when Dr. Furchtgott, working in Brooklyn, was taking the largest blood vessel in the rat, the aorta, and he made this sort of elliptical spiral staircase on this aorta. And then he would immerse it in a bath of saline and it would constrict. But one day he did this same experiment, but there was no cut. There was no injury to the endothelial cells. He immersed it in this bath of saline and it dilated. He did it with another, no cut, dilated. So now suddenly, globally, the race was on. What was the EDRF that Dr. Furchtgott was demonstrating? Endothelial derived relaxation factor. Now, thank heavens that term was with us only about 8 years, because at the end of 8 years, 3 physicians, Dr. Furchtgott, Dr. Murad, and Dr. Luignaro, discovered that the EDRS was indeed a gas, nitric oxide. And 10 years later, those 3 men received the Nobel Prize for that discovery. Now, what you're asking, what in the world is it about nitric oxide, a gas, that warrants it being recipient of a Nobel Prize? Well, it's because of the remarkable functions that nitric oxide possesses for the salvation, preservation, and protection of all of our blood vessels. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, and protect us from getting high blood pressure or hypertension. Now, number 4 is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally everybody on the planet Earth, whether they are from London, Berlin, Chicago, New York, or Pittsburgh, if they have cardiovascular disease, it is because by now in the previous decades, they have so sufficiently trashed, injured, compromised, and turned our endothelial system to an absolute train wreck that we no longer have enough nitric oxide to protect ourselves from making blockages and plaque. However, the good news is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can get patients to understand that never, 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 ever again are they to pass through their lips a single morsel that is going to further injure an already train-wrecked endothelium, because then the endothelium will recover, make enough nitric oxide so we can not only halt disease progression, but we often see evidence of disease reversal. Now, usually about this point in my presentation, as I look at an audience, it's apparent to me that they're sort of asking themselves, gee whiz, I wonder what my level of nitric oxide is. Well, we really don't have yet a good in-office measurement of nitric oxide. However, the thing that's is interesting is that I would like to share with you how it is done from a research standpoint. There you take an ultrasound probe and place it over the brachial artery at the elbow. And there you have the measurement of the diameter of the brachial artery. Then actually, for 5 minutes, you encircle the upper arm with a blood pressure cuff that you inflate over systolic blood pressure, so that for 5 minutes, you have absolutely zero flow in your forearm and hand. Now, I've had that done, and it's not exactly habit forming. But when you've released that cuff and remeasured the brachial artery diameter, it usually, in the healthy individual, it'll be 30% greater because of the outpouring of nitric oxide in response to when that tourniquet was in place. Now, the next great adventure with nitric oxide was when Robert Vogel, chairman of cardiology at the University of Maryland, Vogel took a group of healthy young subjects that he divided in half, and he took them to a certain fast food restaurant that is characterized by arches, which are golden. And the interesting thing was that when the half that had the cornflakes, their brachial artery tourniquet test was normal. The other half had the hash browns and sausage, and within 120 minutes, they no longer could dilate the artery. That single meal had so trashed, so injured, so compromised their endothelial production of nitric oxide, they didn't have enough to dilate the artery. However, being young, as they followed them into the late afternoon and early evening, they began to kind of recover. But you and I know that the next morning for breakfast, it'll probably be scrambled eggs and bacon. Lunchtime, it'll be cold cuts on white bread with mayonnaise. Dinner time, it might be a baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on the salad, and ice cream for dessert. Here in the good old USA, beginning in our early childhood, we begin the incessant, endless injury to the endothelial cells, and it's no great surprise that we have this tsunami of cardiovascular disease in this country. So let's summarize what we've learned. The functions of nitric oxide: it prevents stickiness, it is responsible for the strongest vasodilatation in the body, it avoids arterial thickening, prevents blockages, prevents smooth muscle migration, and destroys foam cells. Now, we only really have time today to look at the endothelial cells, but of these other elements that so well protect us, I think it's important that you realize that every one of these is going to be enhanced and optimized when you're eating whole food, plant-based nutrition. So let's now turn to where the rubber hits the road. Let's look at a study. Now, this was the first study I did started back in 1985. And I had nothing against women. It was just the way the patients were sent to me. And they had severe triple vessel disease. And the whole idea here was to have them eliminate any foods that were going to further injure their endothelial cells. Because I think by now you have recognized that cardiovascular disease is caused by a lack of nitric oxide. And nitric oxide being made by your endothelial cells, if you injure your endothelial cells, then you're going to diminish the production of nitric oxide. So we want to eliminate absolutely any drop of oil. olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a chip, oil in a salad dressing. We want to totally eliminate any oil. Also, anything that has a mother or a face, meat, fish, chicken, fowl, turkey, and eggs. I don't like sugar. We want to eliminate dairy and also caffeinated coffee. Decaf, yes, but caffeinated coffee injures endothelial cells. Now you're probably wondering, where is the data that supports this loss of oil? Well, here's one of multiple studies showing how oil injures endothelial cells. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now here we have some research from Stanley Hazen at the Cleveland Clinic, where he was looking at what omnivores eat. These are the animal foods often eaten by omnivores. And he was particularly interested in the molecules of lecithin and carnitine, which are contained in these animal products. And he found that in persons who are omnivores, they possess in their microbiome, that is the bacteria in their gut, is able to metabolize lecithin and carnitine into TMA, trimethylamine, which is rapidly oxidized in our bodies by the liver to trimethylamine oxide. And trimethylamine oxide is a molecule that injures our blood vessels. So here's the schematic. On the left, you see lecithin and carnitine in those animal products. Then we follow the arrow to the gut bacteria. And when the gut bacteria metabolize the lecithin and carnitine into TMAO, and that leads to vascular disease. But what was even more striking was that Stanley Hazen found that if he gave a lamb chop to somebody who was absolutely, totally 100% plant-based and then drew blood, there was no TMAO. Persons who are totally plant-based do not possess in their gut the bacteria that can metabolize lecithin and carnitine into TMAO. Here is one slide in this entire presentation today that has nothing to do with cardiovascular disease. The reason I included it is that this was, to me, a monumental moment in the history of the world, WHO, the World Health Organization. Think of it. Representatives from countries throughout the world were able to come together and agree that red and processed meat had the same level of carcinogenicity as smoking cigarettes. Pretty powerful. All right. And now, what are we going to have these people eat? They're going to have to eat these wonderful whole grains, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables. Now, it's here that I want to mention a change that I made in our program about 10 years ago. And that is in recognition of the fact that the endothelial production of nitric oxide is age dependent. So that means, for instance, you never heard of a boy or a girl at age 8 having a heart attack. No, they've got nitric oxide coming out of their ears. However, by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So the modifications that I made in our program included a greater stimulation of the endothelial production of nitric oxide. And at the same time, we embraced the newer research, which shows that mankind has an alternate pathway for making additional nitric oxide. And I'm going to share that with you now. I need my patients with heart disease to chew 6 times a day a green leafy vegetable that is approximately the size of half of your fist or less, that has first been steamed 5.5 to 6 minutes, so it's nice and tender. And then you must anoint it with several drops of either a balsamic or rice vinegar. Why? Because research has shown us that the acetic acids from those vinegars will restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon 4, dinner time 5, and of course I adore it when you have that evening snack of arugula or kale. The second benefit from chewing the green leafy vegetable is that you restore the capacity of your bone marrow to once again make the endothelial progenitor cell, which will replace our senescent, injured, worn out endothelial cells. Now, the third benefit, and most important, when you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce that green nitrate that you're chewing to a nitrite. When you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. For minimal expense, with no hideous side effects, what you are doing literally all day long, dawn to dusk, morning to night, you are restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this. Toothpaste with fluoride and public drinking water with fluoride and mouthwash will injure the beneficial bacteria of your mouth. And I do not like antacids because antacids will reduce your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. All right. With apologies to Leonardo da Vinci, no more oil. All right, now let's just talk about some of these results. I'm going to show you several angiograms. These are blood vessels that go to the heart muscle. And these are going to be angiograms of disease reversal. They were reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory. So when I give you the results, I know that it is accurate. Now, there's something on the screen here, Brian, I'd like you to look at that I'm not quite understanding. Just give me a moment here. There it is. Just tell me what that is. Okay. What we're looking at here is the angiogram of a 67-year-old retired pediatrician. This is the left anterior descending coronary artery. And from the arrow on the left to the arrow on the right was described as a 10% improvement. That's about as small as the naked eye can see. A little easier on this next one. This happens to be the circumflex artery that goes to the back of the heart in a patient who was a 58-year-old factory worker. And from the arrow on the left to the arrow on the right, that was described as a 20% improvement. This gentleman is a 54-year-old security guard. You're looking at the right coronary artery, and from the arrow on the left to the arrow on the right, it is described as a 30% reversal. This happens to be a close colleague of mine. This is a friend. This is Joe Crow. And in 1996, at age 44, Joe began to get chest pain. He was not a smoker. He was not diabetic. He was not hypertensive. He regularly exercised. His cholesterol was 156. Chest pain. In October of 96, cardiology did an evaluation, could find nothing. A month later, Joe was actually writing post-operative orders when suddenly the elephant was sitting on his chest. He had pain in his left jaw, his throat, his left shoulder and arm. He was having a heart attack. They whipped him down to the catheterization lab. They start the catheterization and had a cardiac arrest. They resuscitated him, finished the catheterization with one more cardiac arrest. Then he stabilized, and 3 or 4 days later, he was discharged, but he was very depressed. And the reason that he was depressed was that at the time of his angiogram, the entire lower 1/3 of the left anterior descending, the so-called widowmaker, was all moth-eaten and diseased over too long a segment. You just can't pound in stent after stent. And it was too far down the artery to have a bypass. So he was pretty upset about this. And so it was 2 weeks after his heart attack that Ann and I, my wife and I, had Joe and his wife out for supper. Joe, look, you've been eating the typical Western diet. You got the typical Western disease. We've got 10 years of data on plant-based nutrition. Why don't you give it a try? I said, okay, yes, I'll give it a shot. They couldn't offer me anything else, but I'm not going to take those statin drugs. I don't trust them. I said, fine, that's your call. Not a problem. Well, he became the absolute personification of commitment to whole food plant-based nutrition over the next 2.5 years when he had another angiogram to see how things were progressing. And I knew that, and we have that is to say, the doctor's office, and in the doctor's office area, our doors are 3 doors apart. So at noontime on of the day that I knew that Joe had earlier in that morning, he'd had his follow-up angiogram. I went over and I let myself into his office, and there he was, sitting behind the desk. Joe, I understand earlier today you had the follow-up angiogram. Could you share with me, how did it go? And he said, yeah, sure. I think we're doing okay. And lo and behold, the artery was completely clean. Now, this isn't going to happen every time to every artery. However, when the plaque is young and made up of inflammation, fat, and cholesterol, the body can do a striking job, especially when the patients are eating this type of whole food plant-based nutrition. However, when patients are older and the plaque has been there for decades, and it's now made up of fibrosis and scar and calcification, the likelihood of the body removing all that is less likely. However, what is quite striking is that even those patients can so improve, they can get back to full activity of daily living without restriction. And I'll try to clarify that further as we move along today. And I want to show you another artery. This was from a gentleman from Florida who on July 14th, 2017, had a heart attack, and he had multiple blockages. This one particularly is in a branch of the circumflex artery to the back of the heart called the obtuse marginal. This was described as an 80% narrowing. The patient was asked to have bypass surgery. He said, no, I'm not. I read this book, Prevent and Reverse Heart Disease. I'm going to see if I can't do it by diet. And a year later, the cardiologist said, I really want to see what's going on with that artery, because you didn't have any surgery. And now, a year later, it was no longer 80% blocked, it was 40% blocked. At this point, there was a change in cardiologist. And a year and a half later after this one, there was a third angiogram, which showed now the disease was gone. Now, this really brings up some pretty important points. This patient never had a single physician on his voting with him in his behalf and his interest to do plant-based. And it really brings a point up. Why isn't that every patient with cardiovascular disease at least could be offered this option? All right. Now, so I wanted to know in the 18 patients who stayed with us for the full 12 years, I wanted to know how many episodes of worsening coronary artery disease they had had in the 8 years prior to coming into our study while they were in the hands of expert cardiologists. And they had these 49 events of worsening disease before they entered our study. Once they entered the study, in 17 of those 18 patients over the next 12 years, there were no evidence of disease progression. One little sheep wandered from the flock, got into the lamb chops, French fries, glazed donuts, and ended up getting more angina and ended up having to have bypass surgery, but I'm happy to say he's back with the flock. Now, as happy and delighted I was with those results, obviously we had our critics. Dr. Esselstyn, that was not a randomized study. Dr. Esselstyn, that's a very small study. Dr. Esselstyn, what makes you think you could ever do that again and get the same results? We find out it's very hard for us to get patients to follow your program. So we did another study, not 18 patients. This time it was 200 patients, 2 lost to follow-up, so it was 198. Of those 198, there were 177, 89.3% who followed our program close to 4 years. Now, when you think about it, it's almost 90% who were following. And the question comes up, why is it that some people are having difficulty having patients make this lifestyle change? Because no question, if you give a patient a 12 or 15-minute office visit, if you think you're going to get a lifestyle change, forget it. If you're going to get a lifestyle change, you must really show the patient respect. And the only way that I know to show a patient respect is to give them my time. So in our present format, I conduct a counseling event once a month for patients with cardiovascular disease. It's one single day, 5.5 hours. Now, because of the pandemic, it's done virtually. But since I'm a little old-fashioned, when we usually limit this to about 18 or 20 patients, I asked my secretary to give me the phone number of every patient who's coming, and I personally call every one of those patients beforehand for 25 or 30 minutes so I can get my arms totally around their story, and at the same time, share with them how we are going to have them understand the causation of the illness. And at the same time, we're going to have them understand how we are going to empower them as the locus of control to halt and to reverse their disease. Now, let's look at the results. Of those 177 who were compliant, there was one patient who, while visiting China, absolutely totally misbehaved. And he had a small cerebellar stroke from which he recovered. The non-adherent patients, those 21 patients in the close to 4 years of follow-up, had 62% of them had disease progression. Now, I wanted to compare our results with some of the better known cardiovascular results we see here. And we're going to look at those that had major cardiac events, such as heart attack, stroke, and death. Let's look at the box on the right first, and that is the Lyon Diet Heart Study from France. At the end of 4 years in that study, 25% had heart attack, stroke, or death. The box to the left of that, from Columbia Presbyterian Hospital in New York City, the natural history of coronary artery disease, 20% heart attack, stroke, or death at 4 years. To the left of that, Bill Bowden's Courage study. At the end of 4 years, 19% heart attack, stroke, or death. To the left of that, you can hardly see a box. That's our one patient. Now, that is a 30-fold difference. How can that possibly be so different from the other studies? Well, Ever since the days of Hippocrates, there's been a basic covenant of trust that whenever possible, the caregiver will share with the patient what is the causation of the illness. And that's exactly what we do. Anybody who goes through our program absolutely knows that they have achieved their heart disease because they have so sufficiently destroyed their endothelial capacity to produce nitric oxide. They did not have enough nitric oxide to protect themselves. And it's really something that I hope is going to change. As a matter of fact, it was 7 years ago, I was invited to join the American College of Cardiology and be a part of their nutrition committee. And one of the jobs of the nutrition committee is to try to educate cardiologists about the causation of the illness that they've been asked to treat. All right, let's sort of summarize what this is. Pretty powerful to think that with the diet, there is no mortality. With the diet, there's no morbidity. With the diet, there's no added expense because you've got to eat. And with the passage of time, the benefits continue to improve. And when you think about it, most patients who have had a heart attack are sadly walking around with the sword of Damocles hanging over their head, wondering when the other shoe is going to fall. When do they get their second heart attack? Well, nonsense. If they're eating in a way that they're stabilizing the cap over the plaque and thickening it, and it cannot rupture, they have made themselves heart attack proof. Now here we take a look at an interesting slide. On the left, that is a pulse volume. That is the pulse volume at the ankle of a gentleman with heart disease who was 54 years old. And he had a partially blocked artery in his thigh. And he remarked that crossing the skyway to my office, he had to stop 5 times to allow blood to flow back into his calf muscle so he could continue. Well, I totally forgot about his heart. And excuse me, I totally forgot about his leg. And it was 10 months into the study on an office visit. He said, Dr. Esselstyn, do you recall when I first started seeing you, I was stopping 5 times crossing the skyway to your office? Yes. He said, you know, in the last month, it got to be 4, 3, 2, 1. He said, I don't stop anymore. The pain is gone. Okay, then, Don, back you go to the vascular lab. And now you see on the right, the newer pulse volume after 10 months on the program, it had actually doubled. We now had irrefutable, rock solid science that food and food alone could not only halt, but reverse disease. And somebody's going to say, well, wait a minute, what about the statin drugs? Well, remember now, this is 1986. There were no statin drugs. And this is the second patient, Don, along with Dr. Crow that I mentioned earlier, who had striking results of reversal without statins. All right. Here's another leg, interesting. This is this was actually a 78-year-old high school chemistry teacher, and in his retirement, he and his wife loved to enter these square dance contests. But it was during the fast square dance that he was getting bilateral calf pain. So he saw some vascular surgeons who got the images that you see here, and he did not like the large operation they had proposed. He came to see us, and during our consultation, he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of this bilateral calf pain? So I looked at him with great wisdom in my face, and I said, probably it'll take about 10 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, I don't know the hometown of all of you who are listening, but in Cleveland, when you're watching on television, you're watching a mystery or a sporting event, just before the advertising comes on, you will hear the mellifluous tones of the announcer say something like, when the moment is right, will you be ready? Now, we all know that the penile artery is smaller than the coronary artery. And so not infrequently before somebody comes down with heart disease, they may find they're no longer able to raise the flag. However, all is not lost. Not infrequently, when I get 10 months or so after I've counseled somebody, I get a phone call. Dr. Esselstyn, yes, this is Mr. So-and-so. Sure enough, yeah, doc, I really thought I ought to give you a call because something has come up and I'm wondering if I don't owe you another check. All right. Now, before we wrap it up, I promised I would try to share with you how it is that you get this reversal, even in, let's say, somebody who has an older patient who has a blockage or a plaque. What you are looking at here on the screen, especially on the left, is a PET scan. And the PET scan, if it shows heart muscle as being orange or yellow, that's an area that is getting adequate blood perfusion. But you can see on the left, there is a patch of green on the right-hand side, which is an area of ischemia. That means it's not getting its actual blood supply. So I counseled him on that day that he got the PET scan. And it was 10 days later, his cholesterol was checked and it had gone from 248 down to 137. And then 3 weeks later, we repeated the PET scan. And now look, suddenly that area which was green is now restored. So really what was going on here? Let's look at this slide and I think we'll try to make sense out of this. You're looking at the heart with no muscle. You're seeing those three major blood vessels that ride along the surface of the heart before they ultimately dive into the heart muscle and spread out and give all these, as you can see here, all these thousands upon thousands of interlacing intramuscular arteries. So I called to Rodriguez, who is the chairman of Cleveland Clinic Cardiology in the Department of Pathology, and he dissects about 200 hearts a year from the deceased. And he found, indeed, that when I asked him, I said, how often do you ever see any blockage in these arteries once they have dived into the heart muscle? And his answer, never. Now I knew I had the answer, because when I first see these patients and they're sick, their endothelium is so beaten up, they're barely making the great blood vessel dilator, nitric oxide, and your endothelium, when it's so beaten up, is now your enemy. It is making two molecules, endothelin and thromboxane, which are vasoconstrictive. So think about it. Even though all those intramuscular arteries do not have any blockage inside them, they are crimped and pinched and small because of the endothelial production of endothelin and thromboxane. But what happens when they suddenly get treated, immediately as the endothelial cells begin to recover, suddenly you're making more nitric oxide, the great vessel dilator, and your endothelial cells are no longer making thromboxane and endothelin, which are the vasoconstrictors. So when you look at that image you see right there, think of it this way. All those thousands upon thousands upon thousands of interlacing intramuscular arteries suddenly have widened, they've dilated. And that is why for us and physicians treating these patients who have mild chest pain or angina, what happens is often within 4, 6, 8, or 10 days of starting our program, if they previously could walk 2 blocks before they got chest pressure, they find now they have to walk 4, 6, or 8 blocks before they get pain. And they know that what they're doing is healing themselves, and I've got it hooked. Now, so summarizing, the ways of disease reversal, you can see it on an angiogram. We showed you it can happen with a stress test. I've talked about the PET scan, the carotid arteries to the neck. We have shown reversal in those, just as I've shown reversal with or improvement with the pulse volume. and of course, the reversal of the symptoms of angina, claudication, and erectile dysfunction. Before I let you go, I want to show you the A building at the Cleveland Clinic. We're on the 8th floor. I worked for quite a number of years. And I also like to have you know what the trees look like in Cleveland in February, right? When I retired from surgery, I was rehired by the clinic to work at the Wellness Institute. And although the budget there is more modest, the morale is quite high. And there's one thing that I've learned really in some 60 some years since leaving medical school. While brains are important, nothing is as important as persistence, best exemplified by this young damsel in Life magazine in 1939, trying to learn how to do the splits, but she stuck with it and stuck with it and stuck with it. And sure enough, not long ago in San Jose, they found her and she had got it right. Thank you. Happy to take any questions.
That was awesome. Thank you so much. Brian, how did you want to take the questions? I know there was a few in chat, or if somebody wants to raise their hand and ask a question.
I can take a look at them in the chat.
Okay.
What about caffeinated black tea?
That's fine.
Yeah, caffeinated black tea is okay. Someone says, I thought the Mediterranean diet was good for the heart.
Oh, yes, the Mediterranean diet is better than the Western diet. In other words, you can develop your heart disease more slowly, but that's not our goal.
Our goal is to?
No, our goal is to halt and reverse heart disease. The Mediterranean diet contains foods, especially oil, which is going to injure the endothelium.
People always ask about alcohol. What do you think about alcohol?
Well, since alcohol is a toxin, it's toxic to your brain, it's toxic to your heart, it's toxic to your liver. However, to show you how flexible I can be, if you want to have a glass of wine or a glass of beer on Friday or Saturday night, not and, that's okay.
Other questions in the chat?
There was one person here in the community that said it's hard for her to wrap her brain around that because we're so programmed that our protein comes from, meat, that wrapping her head around the idea that we can get enough protein from eating vegetables. Is there anything you want that you can kind of clarify that?
Yeah, have you ever heard of anybody who went to an emergency room and said, my God, help me out, I'm protein deficient? What we found increasingly is that in professional athletics in the NBA and the National Football League, that participants have recognized that they have greater stamina and a more rapid recovery time when they're eating plant-based, and they're not going to be deficient. For instance, there is protein in grain. There is protein in legumes, lentils, and beans. There is protein in vegetables. In other words, practically all the foods that you're eating are going to have protein. There's no way you're going to be protein deficient.
Thank you.
What about other illnesses other than heart disease that this diet can address?
Well, that's an excellent point. And probably one of the greatest gifts that medicine has received in the last decades, 30 or 40 years, is whole food plant-based nutrition. Not only does it eliminate heart disease, diabetes, hypertension, vascular dementia, strokes, obesity, ulcerative colitis, Crohn's disease, rheumatoid arthritis, also lupus, multiple sclerosis, allergies, and asthma. It's been the greatest gift we've ever had, especially for chronic disease.
Please mention examples of green leafies. Can you clarify the green leafies and the balsamic vinegar?
Yeah, the green leafy vegetables. The top six would be kale, Swiss chard, spinach, arugula, beet greens, and beets. If you want the whole list, it goes a little bit longer. Bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula. And the reason I go through that list for you is I want you to know how whole food plant-based nutrition can enhance and restore your memory.
Don't we need more protein as we age?
No, I think it would be adequate. The data increasingly, when you increase protein, you increase osteoporosis, you increase the acidic nature of the diet, and these are not only do you increase the likelihood of diabetes, and really an increased calcium loss through the urine, so that there increased osteoporosis. And my good friend Colin Campbell has shown really how when you increase protein, you can increase the growth of cancer.
Someone's asking, what is the food plan you recommend? Maybe you want to repeat that.
So, you mean the number of the vegetables?
No, what are people going to eat basically?
Well, what you're going to eat are whole grains. You're going to eat all these marvelous 101 different types of legumes, lentils, and beans. You're going to have all these marvelous red, yellow, and green leafy vegetables, the entire list that I just ran off for you, and white potatoes and sweet potatoes. And now there are wonderful, wonderful recipe books. I mean, just in my own book, Prevent and Reverse Heart Disease, there's 140 recipes, another 140 in the book that my wife and daughter wrote, the Prevent and Reverse Heart Disease cookbook, and they just have come out. After working 2 years, there's a stunning one that they've just published called Be a Plant-Based Woman Warrior. And that is got stunning pictures, another 140 recipes. So between those three books, you're going to have really close to 400 recipes. And there are other ones by John McDougall and Neil Barnard. So there's an absolute chorus, and you're not going to have any nutrition deficiencies. And it's opening up a whole wonderful, tasteful world of eating for you.
How about calcium? Should I be concerned about calcium?
No, you don't have to take calcium. You're not going to be calcium deficient.
Where do you get calcium in a plant-based diet?
Through the plants. They're loaded. It's just not going to be, they're not going to be overloaded with calcium. If you want to protect really from osteoporosis, the thing that often is missing, see, the bones love stress. Now let's take, for example, let's have a woman who is age, gets married at 23, has her first child, and from her usual weight of 140, she now goes to 180, and it keeps it. Next child, she gains weight again. She's now at 210. Third child, 220, and then the last child, she's now 250. But at age 50 now, she is so heavy, she has scrubbed all the articular cartilage off of her knees, and she needs to have a knee replacement. When the surgeon is trying to saw through the bottom of the femur to put on the knee replacement, he breaks his saw 5 times. Her bones are like iron. From carrying all that weight, she has strengthened it. Now, I'm not asking anybody to go off and get pregnant and gain 60 or 80 pounds. But what you can do, that has been shown, that if you, for instance, go to the gym and you do lunges will strengthen your bones. Also, squats and will do it. Deadlifts. But if you don't want to go to the gym and all that entails every day, you can go over the internet. You can actually purchase a weighted vest, which you can put on every day for a period of time, and your bones will suddenly feel the stress, and will strengthen.
Someone says, I get SVT. Are there any foods that would help with that?
Yeah, a supraventricular tachycardia. Yeah, I would suggest you see a cardiologist with an emphasis and interest in electrophysiology and cardiac arrhythmias. See if we can't really get a firm diagnosis as what is the causation of this, and then it can be appropriately treated.
All right, other questions in the chat? Let's see. What about adult women who are not overweight? Do exercises for bone strengths and are medically advised to take calcium supplements?
I don't think I'd take any calcium supplements, but I certainly would see if you can't work out a program where the bones can be stretched. And I mentioned lunges, I mentioned squats, I mentioned deadlifts, and I mentioned getting a weighted vest.
Is there a connection between depression to heart attacks in women?
I think you could probably find a study with that, but I think the real key here is even if you were depressed, if you were just eating nothing but whole food plant-based nutrition, you would not have the building blocks for heart disease. But if you're depressed, and one of the features of the depression is you begin overeating or eating the wrong foods, and then that certainly would be a link.
There's one raised hand if you have time to answer Robert's question.
Yeah, go ahead.
Hi, it's great to be here. First of all, I really want to say thank you. I appreciate this presentation. I learned a lot. I'm actually applying to medical school right now, so all this kind of information is really important for me to consume, and as I keep it in mind for the future, hopefully. And I think it definitely sheds some light on how important diet and lifestyle changes are when it comes to treating any disease, but especially cardiovascular disease. And, I just completed a master's in medical physiology at Case Western, and I'm actually a teaching assistant for our clinical reasoning course in my program. And one common trend that I noticed through all of my classes is that the first step in managing any disease is always lifestyle changes and behavioral changes and things like diet. So I'm a big proponent of lifestyle changes before anything else. And as someone who's absolutely fascinated with neuroscience and brain health, and I want to go into medicine to help improve people's brain health, I like to examine these sorts of things from a perspective of neurological health. So I just did a brief dig on the effects of meat, for example, on neurological health. And there's this interesting article in the journal Nature that explains how there are certain nutrients that are important to brain health that are found in meat, and that includes things like iron, zinc, vitamin B12, and fatty acids. And that while these nutrients do occur in plant-based diets, and they occur in lower quantities, and in some forms, they're not readily digestible by humans, and that deficiencies in these types of micronutrients found in meat have been linked with brain-related disorders, depression, and dementia. So my question is, how can people who want to can start adopting this diet and lifestyle change still maintain the proper levels of those micronutrients that seem to be essential for brain health?
Yeah, I think it's an interesting study. First of all, I don't know who funded the study.
Oh, let's see here. This is a pretty long article. It looks like there's a lot of references here. I would have to evaluate that further. I was trying to pay attention to the presentation, but also do a little bit of research on the side here.
Yeah, that's often appropriate and important. The thing is, I've been in the plant-based arena now for about 30 years, and I have yet to see any hard data that shows that whole food plant-based nutrition will accelerate dementia and other things from these deficiencies. It'll be interesting to see if there are other studies that sustain or support that.
B12 is something that everybody should take, though.
Yeah, oh, for sure. Yeah, we do want everybody to take B12.
And here's a great book. I know, Dr. Esselstyn, you know of the Alzheimer's solution that this couple, the Shirazis, talk about
Yeah.
the brain, and there's a lot of
they would agree that once somebody has solidified their dementia, they're not going to be able to touch it. But what they try to work on are those that have mild cognitive impairment. And in other words, before things really get underway, making some significant lifestyle change, you may be able to delay the onset. But that's dementia is really a rascal, and it's really quite elusive still. But I'm quite sure that everybody would agree that with the things that the Shirazis are doing, namely plant-based, avoiding oil, having a rather brisk interpersonal relationship, and exercise, and probably something else I've forgotten. But no, I think they're going at it aggressively.
Yeah.
But I think this gentleman who is doing the research for the Case Western, I think that's an excellent line of to pursue, and it would be interesting to see if there's additional research which is sustain what you've mentioned.
Well, thank you so much, Brian. You guys, I know, are over, so I so appreciate you staying later to answer our questions. And how's the weather in Cleveland where you guys are?
Tonight, it's great. It's
Yeah.
beautiful tonight.
It's
Well,
funny.
Mary, stay in touch and let us know. You know, we do cooking demonstrations. We do all kinds of other things. So if your group wants to see a cooking demonstration or anything like that, let us know.
We would totally love it. I think that's the biggest thing I hear from people is like, well, how do I do it? And I have all the cookbooks that Dr. Esselstyn was talking about, and I have, you know, the reverse heart disease, and then Anne and Jane's new book. So, but that really can be helpful to actually have a presentation and show us. So we would love that. So thank you so much, Dr. Esselstyn. I'm such a longtime fan. I so appreciate your time so much.
Thank you. You're
Thank
welcome.
All right. Have a great night.
Mhm.
Okay, thank you. Bye, Brian.
Bye-bye.
Bye.
Thank you.
And anybody that wants to, just real quick before everybody leaves, the books, I don't know if you saw me holding them up, but to get started, these are great books. This is the one by his wife and daughter. This one, I found so many great recipes, and they're easy. Reverse heart disease, you can get it on Amazon used if you want. And then their son, Rip Esselstyn, who is a firefighter, he's got the Engine 2 cookbook. So those are 3 great ones to get you started. And you can always email me if you didn't quite get the name of everything. I just did some recipes yesterday in this book. They're all fantastic. So that gives you a good start. And then hopefully we can schedule a time for Anne and Jane to do a cooking demonstration in the fall sometime. That would be.
Boy, that would be great.
That'd be great. Yeah. So thank you all for coming. I can't believe we actually had Dr. Esselstyn here with us. We're so lucky, and I did record it, so I guess I can stop recording now.